here to help make you stronger and hopefully healthier into 2016. We do have with us Matt Bravard from Broadlawns, who is a Rehabilitation Therapies Director and Physical Therapist. Thank you for joining us this morning from, like we said, Broadlawns Medical Center. We're moving into 2016. A lot of people, we have the New Year's resolutions, which means we want to get up and get moving once again. That's right. So how can we do that in a safe and healthy way, especially if maybe our bodies aren't moving the way they were when we were younger?
Well, a lot of times we encounter that with the patients that we see, and what we want to do is we just want to try to help people move in a way where they're not going to be injuring themselves, move safely. We really have an emphasis on trying to teach people how to move differently and why their body works in the way it does. Because if you can understand a little bit more about why things work and how you can work with that, then you can be a lot safer, a lot more effective moving forward.
Is part of getting older learning what you should and shouldn't be doing anymore?
I think so, but I think a lot of times people limit themselves more than what they need to. They think, oh my goodness, I'm old now, I can't do this, I can't do that. And a lot of times I think our culture and society maybe presents us with limitations that aren't as real as what they may be. Sure, there's changes when we age in our bodies, but there are a lot of ways to work with that and not just see yourself on a slow, gradual decline into non-activity.
So if you're starting to feel a pain or not moving the way you used to when you were younger, there's ways of getting around that or moving more efficiently so that you can continue to stay active.
Certainly, there's a lot of different ways to address that, and that's what we work with people on an individual basis. Everybody's slightly different in how they present and in the history that they present with, what they've done throughout their lives, and we look at that and we work with what they present at that time and then what direction they want to go as far as goals, and choose the most efficient path to get them there.
So speaking of Broadlawns, how do you guys set yourself apart when it comes to physical therapy? What can people expect?
Well, a lot of times our patients have told myself, my staff, that the physical therapy they experience at Broadlawns is much different than they've experienced previously if they've had physical therapy before. We practice a philosophy of physical therapy, a style called functional manual therapy, and we're trying to address patients' needs in a very complete manner. So we're looking from multiple angles at addressing a patient's needs. First, we would address mechanical issues. Maybe a joint doesn't move like it's supposed to due to an injury, due to habitual use in a certain pattern or position. Maybe a muscle or a soft tissue is tight enough that limits motion from being efficient and effective in what you're trying to do. So we have a number of techniques to address tissue and joint mobilization, get things moving the way they need to. After a joint starts moving the way it needs to, or a muscle group starts moving the way it needs to, you really need to do kind of a re-education process with that whole motor control of that specific joint. And by motor control, I mean just habits of movement. You know, does your muscle in your shoulder, if you're limited with shoulder pain, does that muscle turn on at the right time? Does it turn on with the right amount of strength? Does it turn on with the right amount of endurance to complete whatever task you want it to do?
So if someone is sitting here watching, and let's say they have a New Year's resolution to get more active, is that something you folks can help with?
Certainly, yeah. Yep.
So how do you, going back to what you were talking about, how do you retrain your body to do that? Like what specifically techniques do you guys use to retrain the body to be able to do things like that again?
In retraining to move differently, first you have to be aware of a different movement. If I've had a stiff shoulder for years, my body and my brain literally block out the understanding of moving through the range that it hasn't been able to achieve. So once we mechanically get something moving again, we can put it into a new range. We can ask the muscles to do specific certain contractions so that you literally form a better connection between your brain and the muscle and help it to understand how to move again. It's an interesting thing, the way our bodies are designed, in that if we experience an injury, a limitation, our brain will turn off the muscle function in a certain area, and it will be limited until you ask it to specifically become active again. You can gain strength around the joint in a lot of different ways, but until you ask it to specifically turn itself back on, it just doesn't do it on its own.
So if someone is watching and let's say they have one of the pains that you're talking about, how would they access your services?
You can access our services through your physician referral. A lot of times people will start at their physician and, gee doc, my knee really has been hurting me, and the physician will do an examination and determine if physical therapy is the best option. They'll go ahead and send us on down. We take referrals from our own Broadlawns medical staff. We also take referrals from anybody in the community. So we're not limited just to being a Broadlawns patient with our medical staff. Patients can also access us directly, but we ask them to just check with their insurance companies first to make sure that they don't need to go through that step of the primary care doctor to begin with.
Because you don't want to go through service and find out that they're not covered.
Exactly.
I see.
That's not a good surprise for anybody.
And we're continuing to learn here on our Great Day Morning Show all the various things that Broadlawns continues to serve for our community. And physical therapy now being another one of those that we're learning about this morning.
Great.
Thank you so much, Matt. Thank you. And hopefully you will be encouraged to do everything you're hoping to do in 2016. Even if you have a couple of aches and pains, we can get you through that so you can have a very healthy new year. Thank you for watching, and thank you for staying with us. We'll be right back with more on Great Day. Stay tuned.